Well, let's turn our attention now to the overall COVID situation in Maharashtra. For the last 3 days, the NCP leader Sharad Pawar has been camping in Pune, meeting district and health officials, corporators and his own party workers to discuss ways to contain the spread of COVID-19 in the city, which now has the highest numbers of infected people in the city, in the country, in fact. Joining us now, the Health Minister of Maharashtra, Mr. Rajesh Tope. Thank you, sir, very much for being with us. The numbers in the past 72 hours in Pune district, more than 4,000 cases, taking the total past the 1 lakh mark. Why is this happening at this rate?
No, it's very obvious that now as the total unlock has been done, and so there is no restrictions kept now. All the boundaries of the districts has been opened. Even the all the offices are now allowed to for their 100% facilities. So most of the things, all the hotels are open. So it's obvious that there is a lot of spread being occurred because of this opening and all. And also there is indiscipline in people, because we have gathered more than 1 crore of penalty. Just yesterday I was in Pune, and so just because they were not wearing masks, people are like taking it for granted, and so this happens. But we have to have a strict control, especially by the police department. So we have given very strict instructions on that. But otherwise, you are very particularly asking about Pune. Our death rate of Pune is 2.4 or 5 in Pune. So the death rate is under control. Even the recovery rate is 85%. 85% is the recovery rate in Pune. So particularly Pune I'm talking about. Maharashtra recovery rate is 73 or 74%, something odd.
Are you, Mr. Tope, contemplating any move? Are you contemplating any move for a targeted expansion of containment zones in different parts of the Pune district, given these numbers?
Yeah, what we have done, our Honorable DCM, the Deputy Chief Minister, hails from that area, or is a Guardian Minister for Pune district also. So even Honorable our leader Sharad Pawarji also is
he's been camping over
continuously. Yeah. So my point to tell over here is that yes, the jumbo facility is more than 3 to 4 numbers. Like in one jumbo facility, more than 880. Approximately beds, out of which 600 are of oxygen support and 220 are of ICU beds, with a full facility of all the qualified doctors and paramedics and nurses and all the ward boys, everything. So everything has been given on contract.
No, but Mr. Tope, I understand that, and that's it's good to know that you've got facilities in place. But and this is not just something we are seeing only in Maharashtra. We are seeing this in Delhi as well. This mass disobedience, people are not following social distancing, they're not wearing masks. You say you've collected 1 crore in penalties. In 1 crore in what time period, sir?
It is a time period of just, I think, a month.
In 1 month, you've collected 1 crore in fines, and people are still not listening. So as a state government, what can you do to enforce this? Because it's bound to spike otherwise if you don't do something.
We have again now tightened the police department that yes, you should go very aggressively, increase the penalty or impose it, penalize them if they are not found with without mask, I mean to say. And so I think to strengthen tighten the police department is the only solution. And also the IEC we are emphasizing on, like in information, education, communication. That is to make people aware of, to educate people. By virtue of that only we can impose self-discipline, because self-discipline is very important from my perspective. And self-discipline, for that education is the only mode wherein we can
we've known this all along. The question is, despite the education, despite us being so many months down, this continues to spike at this rate. Does it have to do also with more testing taking place? Is that the reason why we are getting a clearer number?
So testing also in Pune, you will be surprised to know the per million test. It is the highest in the country. I tell you, it is highest in the country because it is more than lakh 1 million for
Is this
in one.
mostly RT-PCR or rapid action test? Is it mostly both?
No, both. But it is the highest. It is the highest per million testing being done in Pune. So we had followed very religiously all the
Sure.
protocols which has to be followed
And
by
you'll be doing sero surveys
ICMR.
as well, right? You'll be doing a sero
Yeah,
survey.
zero surveillance is a request which we had made to central government as well because yesterday.
And what is the status of that?
No, zero surveillance once it has been done, but now zero surveillance at the end of September
End
we
of
are
September.
planning, and so it will be done with a very big sample case. I meant to say, and the sample
What is
will
the size of
be
the sample you're looking at, sir?
no, I think it will be a huge one because yesterday Mr. Javadekar was also
Yes.
present. So we had also requested him that if central government does this type of
Survey,
zero
yeah.
surveillance,
Yeah.
so it will be much better. So both have accepted, like central government and my state government, but we are 100% going to do that. Sample case will be it will be huge sample
No, but
case,
can you
I
give
guess.
us a number? Will it be upwards of what? Upwards of what, sir?
I think previously it was just 5,000 वगैरह, but now it can be more than some. It will be some lakhs, I mean to say.
All right. Mr. Tope, thank you so much for speaking to us and trying to explain what the problem on the ground is. And thank you. And hopefully people will listen, and the government just has to do something. We've seen this in so many
Thank
parts
you.
of the country now. It's a real worry.
Thank you.
Thank you very much, sir.